As part of the emergency project to combat food crisis in Cameroon, PUCA, sponsored by the World Bank and the government of Cameroon, the Northwest Livestock Development Fund, Cdeno, has on Thursday, August 21, 2025, officially launched the mass vaccination of cattle in the Northwest region. This in the presence of actors drawn from all the 7 divisions with a target of 140,000 cattle to be vaccinated this year in the entire Northwest region.
It's a routine exercise that every year we vaccinate the cattle of the Northwest region. Cdeno makes sure the vaccines are available and the staff of Minipia makes sure the exercise is successful on the field. And what we've discovered from our evaluation of the past years is that there's a progressive trend in the increase in the number of cattle vaccinated in the Northwest, which is a good sign that the people are ready now to bring their cattle for vaccination to guarantee the health of their cattle.
The director of Cdeno, while appreciating the response towards the previous vaccination of local fowls with a significant drop in the diseases affecting these local birds, announced that more local fowls will be vaccinated during this phase of the vaccination in the Northwest region.
We are equally happy that the local fowls that we launched in February to vaccinate them, we have gone above 50% of the exercise. We targeted to vaccinate 450,000 local fowls to make them safe from these local diseases that always kill them. And the report we are getting from the field is that this year the ones who vaccinated, the illness did not affect them as it used to affect in the past years.
The regional delegates for livestock, fisheries and animal industries outlines the progress recorded so far in the mass cattle vaccination.
For over the years, since 2020, we have been making progress when it comes to mass cattle vaccination. We started from 120,000 in 2020. 2021, we went up to 121,000. 2022, we improved again to 127,000. 2023, 137,000, and in 2024 we vaccinated 147,000. So we have been improving gradually despite the security challenges. For local fowls, we had a target of 450,000. We had already vaccinated over 250,000. So we are expecting to vaccinate the remaining 200,000.
After the launch, the stakeholders involved in the mass vaccination of cattle and local fowls immediately put in place strategies to meet up with the expected results.
I've drawn my program for mass cattle vaccination. I have 3 adults. I will be starting the vaccination on the 16th of September. I have 3 crutches, Son, Tuner, Wainama, and then Zeremiam. With this vaccination now, I will be able to reduce cattle diseases.
Usually when we're approaching this period, fowls start behaving in a way, some are even dying, but if you look at it very keenly, it's indicating that the last vaccination we carried out was quite successful. So as a result of that, we have been encouraged to believe that if we do so, we shall save so many local fowls that we believe that the common man is relying on them to pay the school fees of their children. So if these fowls don't die the way they used to die, it's indicating that this vaccine is a success story.
The following vaccine will be administered to fight the respective diseases: Pastovax to combat hemorrhage, septicemia; Perivax to combat contagious bovine, pleuropneumonia; Symptovax to fight against black quarter; Nodulovax to fight against lumpy skin disease; and Antravax to combat anthrax. For the local fowls vaccination, 12vax, also known as Dosvax, to fight against the Newcastle disease, local fowl typhoid, and local fowl cholera. After this exercise, the locals have been encouraged to collaborate with the Minipia staff whenever they come around to administer these vaccines so as to prevent the cattle and fowls from dying.